Australians have spent much of the past 2 years inside their homes. Now it's the most likely place many will see out the latest COVID surge.
We have no choice but to ride the wave. What's the alternative?
It's been a bad few years.
The highs and lows of the pandemic have provided plenty of material for comedian Paul McDermott. He tested positive for the virus in the week before Christmas.
Now that I've had COVID, I'll be able to write and sing some songs about that experience as well. But it's a dark comedy.
Paul says despite being double vaccinated, he and his family were hit hard by the symptoms.
It can be a bit of a shock that it's as aggressive as it is. So I think it'd be good that people are aware of that. The sore throat, the burning eyes, very foggy brain, lethargy and tiredness were probably the overwhelming aspects of it, and not being able to think coherently.
Doctors advise being prepared for the possibility of a positive test by stocking up with painkillers and energy drinks, as well as 2 weeks' supply of any prescription medications. It's also recommended to discuss an isolation plan with family and friends.
Most people who are young, who are healthy, who get COVID at the moment, who get Omicron at the moment, are going to have a mild illness that they can deal with at home. And the important things to do are make sure you keep well hydrated, that you rest a lot, and you take paracetamol, Panadol for your fevers. And of course, if you deteriorate in any way, let someone know.
Infectious diseases expert at the ANU, Sanjaya Senanayake, says it's important to reach out for medical support or even call an ambulance if symptoms escalate.
So if people are getting increasingly short of breath, they're getting severe chest pains, they're getting intractable fevers, they can't eat and drink because of nausea, vomiting, diarrhea, or they're feeling dizzy, those are red flags that they need to contact someone.
National Cabinet yesterday dropped the requirement for a lab test to confirm a positive rapid result. The Prime Minister instead urged people to call their GP to tell them they're COVID positive.
People who have COVID should contact their GP. They should let them know.
But GPs say they are already inundated with patients while also administering booster shots and working through the details of the new testing system.
We are at risk of overwhelming all of the health system, and many practices are having to enact their disaster plans. I've heard one practice owner told me they had 1,000 phone calls in 1 hour.
It comes on so fast. Within 2 hours, I went from feeling relatively normal to lying on the couch under a blanket on a day that was over 30 degrees.
On Victoria's Mornington Peninsula, Bridget Nile is isolating after testing positive over New Year's. Her husband and daughter have been dropping off supplies.
Didn't have the strength, couldn't sit up, couldn't possibly go to the hospital to have a PCR test.
Bridget has taken a photo of her positive rapid test, but remains concerned she's not officially counted as a COVID case.
It also means that my medical record doesn't show any proof that I have in fact got COVID. So I'm wondering what that will do to my medical records in terms of vaccines, my immunity, and any long COVID effects that I wish to monitor.
You must report your result to the NHS via gov.uk.
In the UK, people have been told to notify health authorities of their rapid test results online.
This allows the NHS to monitor the spread of the virus.
Today, the Victorian government announced plans for a register to record rapid results. Scott Morrison says he's confident other states and territories will do the same in coming weeks.
With the move to rapid testing and the fact there's no way to record those results, well, not if you're doing it at home and not calling your doctor.
Well, that's a way.
But if you're not doing that, you're just self-managing at home. I've got a rapid.
People are doing that now. What matters is how many people are in hospital, ICU, and on ventilators. That's the real measure of what the impact is. The real issue is that people are connected to care. That's what I'm concerned about. I want to make sure if someone has COVID, that they are connected to the care and supports that are available, including the pandemic leave payments, so they can access those.
We aren't clear on the infrastructure required, and we are currently working with the government to try and work this through, but it's kind of a backwards way. We are going to have to rely on people being honest regarding that, because it's very difficult to verify whose test is who if it's not performed in front of a healthcare provider.
As the world confronts an Omicron surge, some experts say there is cause for optimism.
So having Omicron now, when we've been well vaccinated in the Australian population, is, I guess, a good a time as any to get it. It certainly would have been better than getting it back in 2020.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.